welcome back to Purple Day Diary. This is your Dr. Sandra Vincent, and welcome to my new YouTube video. Okay, so when I was a student, when I was doing my 12th, or when I was preparing for my NEET, UG, etc., I was searching for YouTube videos, searching for content where I can find what all the subjects you study, what exactly you study during medical school in India, because as you all know, I've done my mbbs in India. Okay, so yeah, I'm still preparing for my NEET, PG and stuff. So I finished my mbbs here in India. So there was so much confusion as to what actually you study, so there was not much of a clear understanding into the field of medicine, or what are the subjects, what are the schedule, etc. So I thought, why not I tell you guys about what exactly are you getting into. So let's get started. So I'll just tell you about during my study, what exactly it started with. So first, in my college, we had a foundation course which lasted for almost a few months into the beginning. And what exactly is this foundation? So this basically gives you a clear picture on all the subjects that you're going to study during your course of MBBS. Other than that, this gives you a picture of the empathetic situation a person needs when you're treating the patients, how you should act as a doctor, what are the characteristics you need to develop, etc. So basically, we had CBME education. So it is where you have more empathetic kind of learning, or you have more patient understanding, and you learn more about how a doctor acts when he's around a patient. How do you clinically diagnose the situations rather than just the theory that you study? So you learn your subjects with the patient. So that is what we had. So it is CBME. Okay, so when we had this, during the foundation course, we had various other interactive activities, games, some ice breaking, etc., because we are a new batch of students, and all these things are very much necessary, and all these things were there. And we also had understanding about what all subjects we are going to learn, and various subjects, the faculty came and they taught us some topics from various subjects. Example basically is the emergency management, and all those things were also explained. So these were the things that we actually understood before we actually entered into our first year. So I would say the foundation course, I don't know if it's practiced all along India, but it was there in our college, and so I think it's practiced because of this new curriculum, which is CBME. So it was a very good time where we had more chance to interact among our peers and to understand the subject and to have a very clear understanding into what we are actually going into. Yeah, so now after this brief period of foundation course, we get into our first year. So let me tell you, first year of MBBS is such a thrilling phase. It's where you get to see what you're actually gonna be like. You get the feeling of this, actually being a doctor. You're actually learning the subjects. Okay, so the first two subjects are basically anatomy, physiology, and biochemistry. So most of the science students, we are almost somehow familiar with the basic understanding of these subjects. So yeah, so these are the main subjects, and as you know, anatomy forms the basic skeletal structure of the whole. So you need to learn anatomy to a bit higher level, so you can understand other subjects as well. And physiology is one of the amazing subjects for me personally. So it's how you see the whole mechanical system involved in your body. So that's also one of the amazing subject, I can say. And then comes your biochemistry, and biochemistry is basically all these chemical functions that's going on in your body. So these are the very key subjects that you're learning during your first year. And in anatomy, you have one of the very important moments in your life, which is your dissection, where you actually see a dead body right in front of you. So there are so many stories of people fainting and all that thing. So in my college I haven't seen anything particularly serious, but it's mainly because of the smell. You actually get a bit dizzy and all that. So other than that, it's very comfortable and people are not usually very scared. It's not, it's really exaggerated in the movies as such, but it's one of the amazing experience you have. So you have, I think, the section period almost every day, I guess. I don't remember exactly, but yeah, it's one of the basic where you actually learn about the different structures, nerves, arteries. You learn about the muscles, its attachment. You learn about the organs. You learn about various parts, all these connections, etc. So that is your anatomy. And when it comes to your physiology, basically you have so many practicals, for the physiology to understand, all those aspects, that is there in physiology. And when it comes to biochemistry, you have so many, lab practicals. You do all these tests, etc. This urine test, urine analysis, as such stuff you have to do. So these are also, it's not so boring. It's kind of difficult to score during your first year because people are actually anxious about that it's mbbs as such. And when you have these small exams, you actually feel like you get very less score as compared to how you used to score when you're in your 12th as such. And some people goes into depression because of it, but it's quite usual. You don't score much because the subject is really vast and there's so much to study, so it's not very easy to score. But people really get very anxious during this time. But I feel, for me personally, my first year was the easiest because I was very excited to begin with. Yeah, so I think that's what we'll discuss today. So we discussed about the foundation course, the first year. So these are the basic things that you need to know when you get into the first year, the subjects and what all these subjects cover. And it's one of the amazing periods you have in your life. Thank you for watching. Don't forget to subscribe, like and comment, and keep watching.